Hi everyone, I'm Sergilai and for this slide sets, we will be discussing leptospirosis. Leptospirosis is a zoonotic systemic infection caused by Leptospira that penetrates intact and abraded skin through exposure to water and wet soil contaminated with urine of infected animals. Take note though that there is a controversy that exists as to whether Leptospira can penetrate intact skin. According to an article in the National Library of Medicine, infection may take place via intact skin after prolonged immersion in water, but this usually occurs when abrasions are likely to occur and is thus difficult to substantiate. The website of the medical city states that it may be transmitted perhaps through waterlogged skin. Leptospirosis mainly occurs during the rainy season. The severe form of leptospirosis, known as Wales disease or icterohemorrhagic leptospirosis, presents with jaundice and azotemia from liver and kidney dysfunction, fever, hemorrhage, and anemia. For completion, although you do not need really to memorize this, these are the synonyms for the disease. From this throwback slide from the introductory topics, we note that leptospirosis is caused by Leptospira interrogans with rats, dogs, pigs, and raccoons as carriers. The Leptospira interrogans is a spiral-shaped gram-negative spirochete with hook-shaped ends. It can get into water or soil and can survive there for weeks to months. As such, moisture is an important factor in the survival of the leptospires in the environment. The incubation period is usually 1 to 2 weeks, but ranges from 1 to 30 days. Rodents, especially rats, are the most important reservoir. Other reservoir includes dogs, pigs, opossums and raccoons, cattle, and buffalo. There are several ways of transmitting the spirochete. Take note though that exposure to environmental contamination remains more common than other transmission. This includes exposure to water and soil contaminated with animal urine, exposure to floodwaters contaminated by urine from infected animals, as well as recreational exposure and domestic animal contact. Ingestion of one or more swallows of lake water has also been reported as one of the modes of transmission. In addition to exposure to environmental contamination, direct contact with urine, blood, or tissue from an infected animal is also a form of transmission. Transmission could also occur following a rodent bite, and although very rare, human to human transmission can occur. Such transmission occurs via sexual intercourse, breastfeeding, or transplacental route. Extrapolating from the previous slide, we note that the following are portals of entry: skin, mucous membranes, conjunctiva, ingestion of food contaminated with urine, although this occurs very rarely, and transplacental infection. Occupational groups at especially high risk include veterinarians, agricultural workers, sewage workers, and slaughterhouse employees. After the leptospires enter the body, what happens? The organisms proliferate, cross tissue barriers, and disseminate hematogenously to all organs. Leptospirosis is classically described as biphasic. These two phases are acute leptospiremic phase and the immune phase. During the acute leptospiremic or septicemic phase, the microorganism is found in the blood. This phase is characterized by fever of sudden onset, chills, severe myalgia, headache, anorexia, conjunctival suffusion, nausea and vomiting, and prostration. The fever usually lasts for 3 to 10 days, and in 90% of cases of leptospirosis, the symptoms are actually mild and they usually resolve in less than 10 days. It is actually very simple to correlate that the microorganism is found in the blood during the first phase of leptospirosis. The first phase of leptospirosis is termed as leptospiremic phase. So from the etymology, imia is a suffix for blood. In addition, the leptospira can be cultured from the cerebrospinal fluid or CSF in the early phase. It is important for us to recognize the symptoms of leptospirosis because in a minority of patients, it could actually progress to severe disease. Take note that some references list conjunctival suffusion as the pathognomonic sign of leptospirosis. When reviewing for communicable diseases, you would often hear the phrase pathognomonic sign. So, what is a pathognomonic sign? It is a particular sign whose presence means that a particular disease is present beyond any doubt. Conjunctival suffusion is an eye finding occurring early in leptospirosis. Conjunctival suffusion is characterized by redness of the conjunctiva that resembles conjunctivitis, but it does not involve inflammatory exudates. Conjunctival suffusion is present in 55% of patients with leptospirosis and is uncommon in other infectious diseases. Another significant symptom is muscle pain that is intense and especially affects the calves. All in all, the most common symptoms of leptospirosis are fever, headache, and myalgia. There is really no need to use a mnemonic, but I just remember these symptoms as the FHM. During the second phase or immune phase, there is resolution of symptoms which coincide with the appearance of antibodies. At this time, the microorganisms are found in the urine. It is actually easy to remember that the microorganisms are found in the urine because the other name for the immune phase is the leptospiruric phase. In approximately 10% of cases, leptospirosis presents as a severe disease, and this is particularly important because the mortality rate in these cases would go to as high as 40%. This rare but severe and systemic form is known as the whale syndrome or the icterohemorrhagic leptospirosis. It causes the triad of renal injury, jaundice, and hemorrhage. It is again easy to remember that these are the triad because of the other name, icterohemorrhagic. Ictero for jaundice, and then hemorrhagic for the hemorrhage. And then you'll just have to remember the third part of the triad, which is the renal injury. There are also other accompanying organ failure, such as pulmonary hemorrhage or acute respiratory distress syndrome and myocarditis. The diagnosis is based on appropriate exposure history plus any of the protean manifestations of the disease. We have already mentioned the possible modes of transmission and the manifestations depending on the phase the patient is in. A definitive diagnosis of leptospirosis is based on 1. Isolation of the organism from the patient, 2. Positive PCR, or 3. Seroconversion or a rise in antibody titer. Direct detection methods include microscopic determination, culture and isolation, and PCR. Indirect detection methods include microagglutination tests or the MAT, specific IgM rapid tests like the leptodipstick or leptospira IgM ELISA from PanBio or MCAT and TriDAT, as well as non-specific rapid diagnostic tests like the LAATs or the leptospira antigen antibody agglutination tests. I don't know if you can recall, but in second year of the BSN curriculum, under microbiology, we mentioned there that Leptospira interrogans cannot be visualized by ordinary microscopy, and it can be visualized under dark field microscopy or phase contrast microscopy. This slide contains a lot of information, but the salient points include that the gold standard for the direct detection is culture and isolation, but it actually requires a very long time to accomplish and thus it is not practical. The microscopic agglutination test or the MAT is the gold standard serologic test. MAT is only performed in reference labs and require acute and convalescent samples for diagnostic confirmation, which means two paired serum samples are needed, which delays the diagnosis. Other references describe the MAT as the most specific test. Other lab findings include the following. Complete blood count may show leukocytosis, anemia, and thrombocytopenia because of the infection. Renal dysfunction may be suggested by increasing creatinine, hyponatremia, hypokalemia, and UA abnormalities. The liver is also affected with resultant increase in bilirubin and ALT and AST. The coagulation is also deranged as shown by an increase in PT and PTT. Inflammatory markers such as the C-reactive protein, procalcitonin, and erythrocyte sedimentation rate or ESR are elevated. ECG may detect conduction abnormalities, and chest X-ray may show findings suggestive of ARDS or pulmonary hemorrhage. These are the antibiotics you have for mild disease, doxycycline, amoxicillin, azithromycin, or for severe disease, penicillin, ampicillin, cefotaxime, ceftriaxone, and azithromycin. Usually, what is required for the boards is to remember the first line drugs. So the first line drug for mild leptospirosis is doxycycline, and the first line drug for severe leptospirosis is penicillin G. To remember the first line drugs, I just correlate leptospirosis with a rat. And when I remember a rat, I remember the movie Ratatouille, which is very dope. Dope for DO, doxycycline for mild disease, and PE, penicillin for severe disease. Aggressive supportive treatment is required for multi-organ involvement. Fluid and electrolyte resuscitation is done, and a very critical portion of this management is the monitoring of your input and output. For this presentation and onwards, please keep in mind, do not forget that the adequate urine output for adult is 0.5 cc per kilogram per hour. For severe renal failure, dialysis may be done, and this dialysis could either be peritoneal or hemodialysis. Mechanical ventilation is used in respiratory failure from acute respiratory distress syndrome or ARDS or pulmonary hemorrhage. When caring for a patient with leptospirosis, one must always remember to properly handle the body fluids. Urine from a patient suffering from leptospirosis is considered as infectious, and blood should be viewed as infectious for some time before the onset of symptoms and during the first 7 to 10 days of illness or the leptospiremic phase. Since leptospirosis affects almost all organ systems, we must also monitor for complications. Prevention and control should be targeted at the infection source, the route of transmission between the infection source and the human host, or the infection or disease in the human host. To do all this, one must avoid swimming or wading in potentially contaminated water or flood water. Use proper protection like boots and gloves when work requires exposure to contaminated water. Drain potentially contaminated water when possible, and control rats in the household by using rat traps or rat poison, and maintain the cleanliness in the house. This is an IEC material, usually released when there are flooding in an area, and it discourages citizens from wading in floodwaters. So it says, iwasang lumangoy, lumusong o maglaro sa baha, gumamit ng bota kung kailangang lumusong sa baha, at sumakay sa bangka o rubber boats kung aalis ng bahay. Ang buhay ay mahalaga, iwasang lumusong sa baha. It adds leptospirosis na kamamatay, and that is true for a small portion of patients. This is an IEC material from DOH describing chemoprophylaxis, although it encourages people to seek consult before taking these medications. There are certain levels of risk. We have low risk, moderate risk, and high risk. You do not actually need to memorize the definition of each risk and the dosing of the medication. What is important is that you know that the post-exposure prophylaxis for leptospirosis uses your doxycycline medication. However, doxycycline is contraindicated in pregnancy, and for that reason, azithromycin is used instead as post-exposure prophylaxis in pregnant women. Those are the important points in the care of a patient with leptospirosis. Pause this video, gather your thoughts, and when you are ready, let us have a practice test. What is the most important reservoir? A. Dog, B. Pig, C. Cattle, D. Rodents. You have 5 seconds. And the correct answer is D. Rodents. Which of the following is used for post-exposure prophylaxis? A. Doxycycline, B. Ampicillin sulbactam, C. Ceftriaxone, or D. Penicillin G. You have 5 seconds. If you answered A, doxycycline, you are correct. What is the first line drug in mild leptospirosis? A. Doxycycline, B. Ampicillin sulbactam, C. Ceftriaxone, or D. Penicillin G. You have 5 seconds. A. Doxycycline is the correct response. And for the last question, which of the following findings does not indicate increasing severity of leptospirosis? A. Coracles all over, B. Increasing ALT or AST, C. Increasing urine output, or D. Increasing PT and PTT. You have 5 seconds. Freckles all over suggests ARDS. Increasing ALT or AST indicates liver injury. Increasing PT and PTT indicates derangement of the coagulation, and therefore A, B, and D are all signs of increasing severity of leptospirosis. The correct response therefore here is C, increasing urine output. If you got 4 questions correctly, you did a good job. If not, rewind this video to check your answers. This ends the slide set. Please do not forget to subscribe to my YouTube channel, Memory Aid Nursing. Thank you.